welcome to SQ TV. I'm your host Rajni Bharara, and today on the show, guys, I have with me a very special doctor. His name is Dr. Karim, and he is a veterinary doctor. And he is a veterinary doctor, and I would like to tell you guys that today on this episode, we are going to speak with him about how can we take care of our pet animals, street animals, and also how can we stop their pregnancy and how can we take care of the animals during their pregnancy. Well, we know a lot about humans, but today it's time to talk about animals. So without any further ado, let's welcome him to SQ TV. Hello, Dr. Karim. Welcome to SQ TV.
Hello.
Dr. Karim, so, without wasting any time, I would like I've mentioned, that today's topic of discussion is going to be about animals and how can we take care of the street animals, our pet animals, and also about, their pregnancy. I mean, how can we take care of them during their pregnancy and how can we stop their pregnancy so that, we should not have too many animals and then we should not make them homeless. So, which is happening in today's time quite often. So, I would like to know from you my very first question. So, my very first question is going to be, what should we give our pet animals to eat? If you can please talk about that.
First of all, as a veterinarian, I would recommend that there are lots of foods. I would like to say that for pet animals, our pet parents should be must aware of this. They need a high amount of proteins, carbohydrates, minerals, and fats, etc.
Okay.
They have a particular habit of eating. That is, they would like to eat a small quantity of food throughout the days. For the whole days, actually. Okay. From the first breakfast, we can start from some commercial foods. We can feed them like commercial foods. Nowadays, many commercial foods are launched there, so we can give them the commercial foods like pedigree, Royal Canin, etc., etc. And there are many brands. According to the owner, a pet parents should check first that which commercial food is suitable for them, because we all know that in case of humans also. All commercial foods are not for all humans, actually. They're not suitable for all humans. For example, some people, some animals are getting suited from Royal Canin. Some other animals doesn't get suited from that particular foods, like Royal Canin, actually. So we have to check. Then a pet parent should get aware from this. At the very time of breakfast, they can try. Sometimes you can see that many times like commercial food like Royal Canin and pedigree. After eating pedigree, they used to vomit. But that means the animal is not suitable for the food. Okay. So we can. So we have to. I can recommend to owner that start from the very small quantity. Very small quantity.
Okay.
If the food suits your pets, then continue with it. Otherwise, withdraw this. Change the brand. Like there are many other brands of commercial food like Formina, etc., etc. Yeah. Like after the weaning period of the pets, after 36 to 40 days. Up to 3 months of age, they should be fed liquid food or semi-solid food. Not it is better to avoid such type of solid foods like rice, chicken from the very beginning. From the very beginning, you should avoid it.
Both for whether cat or dog or whatever animal that you have. So I was saying, so for any animal that you have, I mean, whether it's a cat or a dog or any animal, pet animal that you have, so you should not give them, chicken or that solid food.
No,
you're saying
from the very beginning, solid food is not recommended actually. From the very beginning.
Oh, okay.
From the very at least up to 2.5 months. Okay. There are many commercial foods, commercial liquid feedings are there. After the weaning period, there are many commercial way of foods like they have the Samolac and they are Immunolac and other type of cereal foods are there. So we can feed them like this.
Okay.
From the first 3 months, like up to 2.5 months of age, we can feed them this type of liquid feeding. And other commercial foods are there. Like you can get Royal Canin seeds, which after mixing with lukewarm water, they used to get semi-solid. The semi-solid foods we can give to them. And after 2.5 months of age, we have to start slowly the solid feeding.
Okay.
Slowly. We have to start with a very small quantity of the food. The very small quantity of food we have to start. Then after 3 months, 4 months, we have to gradually increase the quantity of the food so that they get adapted to that. After 4 to 5 months, they used to get we should not give them. Like first time, I will say that chocolate. So I got many cases regarding this. That one owner came to my clinic and he's asking that, sir, he ate a lot of chocolates yesterday, and after that he just vomited. So it's not recommended actually. Chocolate is
Okay.
really poisonous to animals. Okay,
Okay. Okay.
that should be avoided. Foods, in
Mm-hmm.
case of foods like we used to feed them at the lunch like chicken, we can feed them many types of chicken, rice,
Mm-hmm.
and other vegetables like we can give them papaya, we can give them pumpkin, we can give them carrot, beans, etc., etc. Like broccoli, it's highly recommended. Broccoli is highly
Mm-hmm.
recommended actually. We can feed them, and in the dinner, it's better to
Mm-hmm.
go for the go for the same. No problems there. But
Mm-hmm.
sometimes they need some liquid feeding like soups,
Acha.
like chicken
Okay.
soup, etc. Chicken soups. For example, they have the lunch lunch in the lunch. At the lunchtime, they have like chicken rice. In the dinner, it would be better to go for the soup like chicken soup or chicken soup mixed with some carrots and beans and other
Okay.
vegetables. It's about up
Okay.
to owner's choice actually. We can feed them many
Mm-hmm.
types of vegetables, many types of red meat should be avoided actually. Actually,
Okay.
it's
Red meat.
red meat should be avoided. You can give them sometimes, but very rare. You can give them as a treat, but not much. It should be
Okay.
the most important thing a pet parent should keep in mind that the food should be freshly boiled, not added any types of masalas, etc. So no needed of that. This turmeric powder is recommended. Therefore,
Mm-hmm.
food must be totally hygienic, totally fresh, and totally boiled. Actually,
Mm-hmm.
it may be chicken, it may be rice, it may be other vegetables. All the foods should be boiled. We used to feed them like 4 times a day. Within 24 hours, we can feed them 4 times. In the middle of
Mm-hmm.
the time, if they want to eat, they can. No problem. It's there. Like from the at the first, we can give them like commercial foods along with waters and other. We can give them bananas, etc., etc.
Mm-hmm.
And the lunch, we can give them chicken or rice. In the evening, we can give them some snacks, their dog foods, etc. And
Mm-hmm.
in the sorry at the dinner time, we have to go for the soup. Rice is also may be there. Rice may be there at the dinner time. It's not, I'm not saying that no rice is recommended at the dinner time. I will not say that. But in some cases, in some not many cases, it's better to go for the soup. At least at the night.
Okay. Okay. But Dr. Karim, here is one thing I would like to know from you. So, when we talk about humans, it is said that, the packaged food that is available in the market, we should, avoid, the consumption of those packed foods or those particular products. But when it comes to animals, I mean, is it also harmful for them to, make them consume those packed foods or those market available products?
Packed food means which type of packed food? Like you are saying about the commercial foods of dogs.
Yeah, the commercial foods, which is,
So
I mean, not cooked by humans.
from the very first, I told you that a pet parent should check and for this particular queries, a pet parent should
Okay.
consult to the consult to the doctor first.
Okay.
It becomes for that because all commercial foods are not suitable for all animals actually. Some people can digest royal canin and some animals can digest royal canin and some animals can't digest royal canin.
Okay.
Some animals can digest pedigree and others can't. Some can digest
Mm-hmm.
hormina and others can't. So from the very beginning, we have to start with a few amount of that. If the animal vomits or if we see that it's not suitable for the animal, we have to change that, and then you have to consult to
Okay.
the doctor. But before that, before starting any type of feeding, like
Mm-hmm.
recently I've got a case like a owner came to me. He has purchased a dog from some place, and he came here. What should I give to eat to my? It is a it should parents should be aware of this. They should come first to the doctor. first of all, they have to consult with the doctor first with the
Mm-hmm.
proper guidance. Okay. So after that, they can start a commercial feeding, which the doctor recommend. First of all, you have to check the patient thoroughly. After that, we'll suggest that you can start this commercial food, not that commercial
Mm-hmm.
food. We will tell them after that. So if sometimes we can see that, sir, I have many owners call me and they used to say to me that, sir, I have given the farming food and they used to farm it. That means it's not suitable for him. They'll go for the another brand. So first of all, any type of commercial foods, so you have to start with a very small quantity.
Okay.
So you'll be
Okay.
aware. After that, you will get aware that it's suitable for them or not. If it's suitable, then go for it
Mm-hmm.
with consultation with doctor. Actually, they will remain with they will carry on the regular consultation with the doctor at least for a week
Mm-hmm.
that it's suitable or not.
When the animals get sick and people, sometimes it happens that when their pet gets sick, so people don't directly want to rush to the hospital and they don't directly want to go to the doctor. So what they want to do is they actually want to figure out a way to treat their pet at home. So while they are in such a situation, so what would you recommend them to do at home level or in the home environment? How can they treat their pet, and what should they do first when they find that their pet animal is sick?
What is this concept that a pet owner or a pet parent don't want to take to the vet?
Well,
Don't want means
I understand.
but don't want, huh? They are not able to take to the vet in such a situation.
Yeah.
But what is the meaning of that? That they don't want to take to the vet. What is this?
No, no, sometimes it happens. Exactly. It also happens with people too. So when they get fever or when they get a headache or anything, so they really don't want to rush to the hospital and see a doctor. What they want to do is they just want to treat somehow with some home remedy, or if they're having fever, so they want to either take paracetamol, or for a headache, they want to take a Disprin, such things. So they at least want to try a few remedies at their home level to treat themselves. And after the thing is a bit severe, then they rush to the hospital. The same also happens with their pet too. So when something like that happens to the pet, what should they do?
So you're talking about the self medication.
Yeah, self medication.
Okay, this is actually a misconception. Self
Okay.
medication. Okay,
Okay.
I will not recommend this actually. In case of humans, you have to keep in mind one thing that in case of humans, they used to
Mhm.
talk, they used to express their feelings. That
Yeah,
I have,
yeah,
I have a problem here. But in case of pet animals, that doesn't. So I would recommend that always try to consult with a vet if there is a situation in your house that you are not able to take your pet to the hospital. Nowadays there are teleconsultation. I mean online consultation is there. They can
yeah.
consult with doctor over phone. Okay, following some terms and conditions, they can consult over phone to the other doctors. I will recommend
Hmm.
that to all the pet parents that don't be the pet owner, be the pet parent. Don't be the
Okay.
owner. It is his owner.
Yeah,
Don't be the
yeah.
owner. Be the pet parent actually. So if you are a pet parent by your heart, so I can recommend you that first of all you can go for the teleconsultation with the doctor for the
Hmm.
emergency remedy. What can we do, sir? In this particular case, recently, like a few days ago, a pet parent called me at 12 o'clock at night. He told me that, sir, my pet is having some serious problems. He's suddenly fall down. So I told him that there was a thermometer or not in your home. So he told
Hmm.
that he has not. So I would recommend that this should be kept in mind by a pet parents that the thermometer is a
Hmm.
primary and the thing you should keep in their home for them also for their
For
pets.
yourself.
Okay.
Okay.
Then I told them they have to measure temperature. They bought a thermometer from the nearest store. So the
Hmm.
temperature was abnormal. So I even told them how to manage that. That is possible actually. But after the night is over, after the night is over, you have to consult live. I'm saying that you have to then a pet parent should take to the particular dog to pet the particular doctor actually to the clinic.
Okay.
Like I told, in that case, I told that okay, do one thing, do this and this, and I told some points to them. So they did it, and the very next day, they brought the patient to my clinic. So this can be recommended actually, but not self medication.
Okay.
Actually, especially pets. Actually, I will never recommend any self medication. Actually, I personally not.
Okay. Great, great. I think, you're absolutely fine, because it also happens with humans too. I mean, people too. So when people generally go for self medication, it actually makes the condition even more severe when they don't exactly know what is happening with their body, and they, that directly take the medications. It actually also happened during the COVID time. People started taking self medication. They started taking, the medicines by themselves, which is recommended by their friend or a friend to friend. So, which actually hampered the situation, and it made it even more worse. So, you actually gave a great suggestion, and you actually gave a great recommendation that you should not, you should avoid self medication. So, but with this, I have a following question too. So, exactly how we have medicine for fever. If we get fever, we can take paracetamol, and if we have headache, we have Disprin. If we have stomach ache, we can take Pudin Hara or any medicine that is available. Um, so to better the condition. So for animals, do we have any such kind of medicines in the market that we can feed?
Actually, I'll not talk about that Putin Hara. In case of humans, we should give paracetamol. But after the for an example, a month ago I fall sick, and at the time my mother told me to take a paracetamol and take that. After that,
Okay.
I got some gastric problems actually. On the very next day, I went to doctor and he told me that stop. He also told me this particular these things which I'm going to tell you, that stop that type of self
Okay.
medication. What is this paracetamol? What is
Okay.
this Disprin? What is this Calpol? What is this? Stop self medications actually. But yes, in some kind of emergency remedies, if you are taking out emergency, you have to take. But because all time we're not getting doctors on our
Yeah.
phone also, so we can take in
Mhm.
case of humans. But in case of animals, I told you very early that the human can speak and human can say. And human can say, he can feel,
Yeah.
he can express the feelings, but animal will not
Yeah.
able to do that actually. So
Yeah. Yeah.
I will recommend the same thing, that is certainly consultation or online consultation with the doctor. Nowadays, many
Okay.
doctors are officially doing online
True.
consultation to help the pet parents actually. For the last
Hmm.
5 to 6 years, I'm a pass out of 2018, and I'm now a master degree scholar, the Department of Surgery and Radiology.
Okay.
From the last 5 to 6 years, I'm watching that many veterinary doctors are exploring themselves, and the veterinary fields are getting explored actually. So
Hmm.
many doctors, including me, has started the official online consultation for the emergency remedies to the pet parents. That
Yeah.
especially
Yeah.
because we have started all this just because we just want to avoid all the pet parents to avoid the self medication. That's why we have started actually. For the particular reason, online
Okay.
consultation is started. To avoid such type of self medications, don't go for the paracetamol, call a doctor, and he will suggest you.
Whether for humans or for animals, self medication is a strict no-no.
I didn't get that. Please
So
repeat.
I was saying that, yeah, I was saying, so whether for humans or for animals, a self medication is a strict no-no from your side.
For human, I don't know because I'm not licensed for a human doctor actually. I'm a vet.
Yeah, yeah,
So
yeah. Hmm.
for the betterment, we have another way. We have a better way to consult online with the doctor. So why you should go, why we should
Yeah,
why we go for the self medication? No,
yeah, true,
there's
true.
the alternative
They
way.
should
There's the
not,
alternative way.
yeah,
Especially for
they
the
should
pet
not,
animal,
we should
self
not
medication
heighten
should be
the
avoided
risk.
actually. At least for
Yeah,
the pet
yeah,
animals,
definitely. Yeah.
because it may harm their, because when they are not able to take to the doctor, okay, pet parents they are seeing just grossly just that his animal falls sick, he's not standing up, his temperature is 106, he's not eating at well, but they doesn't know what's going inside there, inside the
Hmm.
animal.
Yeah.
Okay, in case of human, they would say that I have some problems here and there. Used to speak, but they can't speak. They can't say that I'm getting problems, but in particularly here. This particular thing should be diagnosed by a registered veterinary doctor. So
Hmm.
that's why I would recommend actually. It's for the betterment of the pets actually, as well as their own appearance.
Definitely.
That try to avoid self medications. Yes, paracetamol is
Yeah.
there, but in some cases I've already experienced that. An owner gave his Labrador dog a 650 paracetamol. From the very least, the animal has vomited that. And after that, the condition is also
Yeah.
deteriorated. I'm not telling that it's toxic, paracetamol is
Yeah.
toxic, but first of all, a pet parents has given, but he doesn't know that what's going inside his pet. Actually, it should be diagnosed by a doctor.
Yeah.
So for this particular
Yeah.
mismanagement, for this particular mismanagement by the owner,
Mhm.
teleconsultation has started actually. So go for the teleconsultation. You are available 24/7, no problem.
How do we know that it is an emergency and that it is a time we should go see our veterinary doctor, or we should go take our pet to the doctor?
We have to be aware in this, at least at the time of pregnancy of the animal. This point should be noted at the time of pregnancy, especially at the time of pregnancy, at the time of at the time when a patient is already going through the through a treatment, and sometimes we can see that there are sudden fall of temperature. That's also emergency remedy, emergency not remedy. I'm sorry, it's not that that's an emergency situation. You have to go for the vet. Okay, I would recommend for an example, suddenly there are some cases like epileptic seizure. This is actually a nervous problem. So I used to say that in the midnight, many patients has or in any other time they used to get epileptic seizure. So that's the time, that's the emergency time we should consult with the doctor. First of all, you have to consult with the doctor because all the time doctors are not available. So up to the available time of the doctor, when the pet parent should consult online with the doctors. After that, then by taking an appointment, they can contact to the clinic. An emergency means if you're saying that emergency, first of all, we have to understand what is the emergency. What is the emergency case? Emergency case means sometimes you can see. I told you earlier that a sudden fall of temperature or that
Yeah.
other problems like any other food toxicity. But in emergency cases, for the time, I will recommend that don't wait for anything. Go to the doctor and consult with him. When the available pet clinics are there, online consultations are there. You can go any other option. You can go for that options of your choice. No problem.
Okay. But doctor, okay. So now that you have spoken about, you actually mentioned pregnancy and you have spoken about pregnancy. So I actually would like to take the topic pregnancy here, and I would like to ask my question. So, before I ask you about how can we take care of our pet animals during their pregnancy, I would like to firstly ask you that, in animals, because, when they get pregnant in quite few duration. I think in 3 months or 4 months they get pregnant and they deliver their babies. So when such thing happens, we get too many animals, and then the situation also it also happens with the street animals too. So what happens is they deliver too many babies, and then those babies become homeless. So what can we do to avoid their pregnancy, and how can we treat them, especially for the dogs and the cats?
You are telling the first of all, let me clear that you are talking before the animals get mated or after mating. You have to check about that. First of all, for the prevention of maybe such huge population of animals, or you're telling about that. No, that how should you avoid
Yeah,
that
yeah,
such increase of populations? Okay,
yeah.
then nowadays animal birth control program started in many places.
Mm-hmm,
Okay.
mm-hmm.
There are many places where doctors used to spay their animals. I would recommend that go for the ovaryctomy or go for the castration. In case of female animals, you can go for the ovaryctomy. In case of male, you can go for the castration also. Many owners used to ask to the doctors that if there is some contraceptive pills or not, but it's not highly recommended. It's not recommended at all actually because it may
Okay.
hurt their reproductive organs. Better to go for the ABC program like castration or ovaryctomy. And if you see that the animal is already, because some cases, especially in case of street dogs, we used to sometimes accidentally they got pregnant because recently in an ABC program I got that that animal is pregnant. So what can you do, sir? Is it possible to neuter that animal, to spay that animal or not? So
Mm-hmm.
I would like to recommend that if the animal is already pregnant, we have to we should not go for this thing actually.
So I was saying before the animal, before the animal becomes an adult, and before when the animal is growing actually. So at that time we can go for the program. But after, what happens is, after the animal is an adult and has delivered babies. So when there are too many babies, so the people wants to stop their pregnancy for the next time, so that it doesn't deliver babies again. So for at that time, should we should we go? Can we do the program? Can we go to the program, or should we like avoid going to the program?
We can go for the program, but first of all, after purchasing of an animal, the mother animal must be diagnosed by a doctor. We can go for the ultrasonography to check all the organs. Today, for example, today as an animal is purchased, some babies, 4 or 5 babies. After that, fluid therapy is related to that animal, mother animal. Okay, so
Mhm.
after that we can go for the ESG, and we can go for that program after 2 months. It will better to go for that program after 2 months
After the baby is delivered.
after the baby is delivered. Because
Uh-huh.
first of all, they need mother's milk. Because if we
Okay.
after parturition, if we start the program, we have to operate the animal. So regular dressing is required for that animal. During the dressing, after the bandaging, the births are mainly closed actually. So I think babies should get the mother's milk for at least 40 days, and after 2 months, we can spay the mother animal.
Okay, okay. Great, great. Thank you so much, Doctor, because it was a very important question, I suppose. And also, this question is searched quite a lot by the people because in this, especially in the street animals, these things occur. Then people, wants to stop their pregnancy and don't want too many animals to be homeless, which is why they want their pregnancy. I mean, the animals to not get pregnant. So now, one last question to you, Dr. Karim. So, if you can also please talk about how can we take care of the street animals, and the one who actually takes care of the street animals, do they need any kind of protection before they go and help the street animals?
First of all, I would still like to say that I'm happy to see that nowadays there are many animal lovers. There are many such NGOs. They are taking care of the
Yeah.
animals, and they used to contact with us day and night. That sir, this animal has got injured. This, what can I do, sir? What can I do? I have to help them online.
Yeah.
No problem. No problem. So I would like to advise one thing to all the animal owners that they should start a program of monthly program for to take care of the animals. I've seen one thing in village areas actually, particularly in our West Bengal. There are mobile veterinary clinic. You should see that there's a mobile veterinary clinic.
Mm-hmm.
In that particular clinic, a medical van is provided to a doctor, um, and
Okay.
they have to go from to a particular village in that day, and they have to treat all the cattle, buffalo, sheep, goats, and other animals in the village in the particular day. The next day they will change the place. So I think
Mm-hmm.
this system should be started in case of street animals also. I mean street dogs also. Like in our Kolkata, make some vaccination camps yearly vaccination camp for where we used to give them free anti-rabies vaccination to all the street animals. This thing should be carried on. This thing should be continued. I appreciate this. Other this, we have to take care of the deworming. We have to take care of the deworming. Recently, I met an animal lover. He's a professional animal activist actually. So
Mm-hmm.
he was asking me that, sir, I've started from the last year, but I haven't explored this street animal. So you wanted my cooperation. So I advise that let's do one thing. First of all, I have to choose a particular area. In that particular area, we have to go with our team. And first of all, we have to go for the general checkup of the animals. There are many
Yeah.
now people are getting many crashes, many animal dog
Okay.
crashes, many crashes,
Mm-hmm.
and the crashes are provided by the NGOs also. It's very good.
Mm-hmm.
In the particular area, a dog should be checked properly. It's healthy or not. So its feeding habits. We have to know about the feeding habit. So nowadays, many animal lovers are regularly giving them food to the street animals. They used to give
Yeah.
that.
Yeah.
We can also see in the social media also that they are giving food to all the animals. They are treating all the animals freely. Go for this, and beside this we have to check all the food habits of the animals and all the activities that this animal is proper his or her health condition is proper or not. You have to check first of all that. Then first of all you have to go for the deworming if possible, but anti-rabies vaccination is needed very much. We are already all the animal activists, all the veterinary doctors are continuing with this a particular animal vaccination camp. But we have to go look after the deworming also in case of
Okay.
street animals.
Okay.
Because nowadays street animals are also getting cared of many doctor by many doctors, by many NGOs or NGO workers or other animal activists.
Yeah.
They're getting cared.
Mhm.
Especially I'm seeing in Kolkata, and it's really I'm very happy to see that they
Mhm.
used to take care of the animals. They used to call me day and night, sir, I need some help for this or this, and like
Mhm.
and through online consultation, we all used to give them such type of help. They used to treat the animals. But yes, I will say that or to all animal activists that to consult regularly with your nearby veterinarian so that you can get the regular update. Nowadays medical science is updating day by day, so you
Mhm.
have to.
Mhm.
So an animal activist, a professional animal activist should be aware of this too. That if you at least for a week or for a month, he used to consult with his doctor, with one nearby veterinarian. That's what should I
Mhm.
do for these animals. So this consultation, I think it will be better. All the street dogs will be cared through this process.
Thank you so much, Dr. Karim, for coming to the channel and speaking with us. It was a great conversation and a highly educational conversation, which might have helped our audiences quite a lot. So thank you so much again for coming to the channel and speaking with us. It was lovely having you on the show.
Thank you.
All right, guys, that's it from SQ TV. Keep on watching and do subscribe to the channel.